There are many challenges for families and children in Palm Beach County. The foster care system, a lot of kids have been thrown into that system. That can be traumatizing, physical and mental abuse.
Some of our students come from families and homes where they're constantly in crisis, whether it's an addiction that's impacting the family, abusive parents, whether it's physical or emotional abuse, or even immigration issues that really are challenges for our families who are looking for work and looking to find a way to maintain a wholesome environment for their children.
I recently was able to go out and visit some of our child care centers, and when I'm talking to the providers, often I hear about what they are working with the families and the children with on a regular basis, whether it's racism, extreme poverty, homelessness, really significant developmental delays, some child abuse. There's lots of issues that they deal with on a regular basis.
Abuse, neglect. Just about the time I say I've seen everything, something new would come up.
Well, what we studied the adults, but then we also looked at the exposure to different traumas as a child. So were they exposed to physical abuse? Were they exposed to sexual abuse? Were they exposed to poverty and lack of food when they were kids? And how does that impact them today? So we had a questionnaire, and we're seeing that those adults now who were exposed to certain types of traumas as a youth are more likely to have certain chronic illness now as an adult.
So what was the thread that you saw on all of this throughout in these people talking?
I think one of the neatest things is how everyone really opened up about working together and kind of the momentum that Palm Beach County is just kind of in the midst of, headed towards being trauma-informed. I think everyone's really open to working together. It was just really positive. Even just the ease in which we were able to set up all these appointments and interviews and how willing everyone was to be a part of the conversation, I think was really kind of incredible. And the connections I think that we've been making and they've been making with each other and the whole community, I think since we've started this project is really starting to come together.
Now, I was just thinking about Quantum and how much they have supported us since we started with the Center for Child Counseling, and they have supported that early childhood, that concern about the young child and how that will be well and how important it is. And then with ACEs, and now with ACEs, it just brings it all together under a true explanation of what this adverse childhood experience is about, and yet we've been doing it all along, and with their support. They've been amazingly supportive.
Adverse childhood experiences are shown to have what's called a dose-response relationship to health outcomes. So the more adverse childhood experiences you have, the higher likelihood that you're going to have negative impacts on your health. And that could be anything from cancer, smoking, maybe depression, substance abuse disorder, just across the gamut. Oftentimes when we talk about health and the health of a community, we think of we think of diseases, we think of conditions, maybe depression or alcoholism or cancer or smoking, actions that individuals take. And oftentimes we look at those health outcomes in exclusion of why they're happening and why people are making these choices. The unique thing about looking at ACEs is it talks about not just, it really kind of refocuses things for us back more on a preventative and a very early intervention stage. So if people are having adverse childhood experiences at an early age especially, then we can respond earlier rather than waiting until they've started smoking or they're diabetic and they're 45 years old and maybe need medication and some a higher level of intervention to offset those behaviors. So that's the connection for us as a health foundation, is really trying to get even further up the road, even impacting people before they're showing these negative effects that may happen from ACEs.
And that early intervention, that whole prevention piece is actually brings us to our interview with Dr. Fox-Levine. Shannon really spoke to the need for preventative care and how in pediatrics that's what they're doing. They're really trying to look at the whole child, the family situations that these children are coming from, and work with them holistically and make sure that they have the resources they need and refer out to organizations like ours when kids need them.
And I think our vision is that we want all of the pediatricians screening for ACEs and having an awareness of ACEs. So,
as pediatricians, we are born and bred, so to speak, to be preventive medicine doctors. That is, most of my day is spent keeping kids healthy. Sure, I have the average day where I might have, in the winter, more kids with flu, ear infections, but when I look over the course of the year, what am I really doing every day? It's giving kids vaccines to prevent illness. It's screening for mental health issues to prevent them from having issues in school one day, or issues at home one day that get beyond the time that we could easily intervene. So as pediatricians, we do this without even thinking about it. It comes natural. It's why we all went into it for the most part, to keep people healthy in general. And I think it's an easy concept for many people to think about the vaccines. It's a hardcore science. There's an injection with a certain amount of antigen that has been studied, and we can measure in the blood the titers that they achieve, so we can say, aha, you're protected against tetanus. And we can kind of stamp that to say, yay, we prevented tetanus. It's much harder because it's a softer science with any of the mental health problems. And for that reason, it takes a lot of different types of strategies to recognize through screening processes if there's an issue. The number one thing we do, and it has become pretty routine, recommended by the American Academy of Pediatrics, is healthcare screening questionnaires. So for instance, when a mom comes in with a newborn, we have a postpartum screening questionnaire that we have the mother fill out. And that's our very first introduction for the family to recognize that we're going to care about these things. We're going to be asking about how mom is even doing. Is she sleeping? Is she more sad than usual? Does she feel like she's coping? So that it comes natural when in a year and a half at the 18-month-old visit, we start asking questions about screening for autism. Is the child connecting with the mom? Does the child look to mom when she's hurt or sad? Eye contact. And then we continue into early childhood with more screening to check for how the child is growing social emotionally in school. Are they making friends? Are they able to sit and focus in a classroom setting? And then on into high school. There's another screening questionnaire we use to look for depression and anxiety. Those are teenage problems that if we didn't ask, we wouldn't know. They're not going to necessarily volunteer that information to us. And it's a good way to do it because it's a piece of paper and they just can fill it out any way they want. It's our job to try to figure out what they mean by some of their answers sometimes. But it's again the introduction, and I find that starting with day one of asking the mother these questions about herself, it's a easy way for families to just come to think of this is just normal, this is routine, this is what our doctor cares about.
I am at a forum today that is dealing with infant mental health, and a part of the forum we were also talking about adverse childhood experiences. Health professionals need to know and understand this information about infant mental health as well as adverse childhood experiences more, because in the hospital we often see people as non-compliant, and the reason that they're non-compliant is because of the experiences that they have gone through. And most of us don't understand about experiences, so we have a tendency to just sort of judge them based on the fact that they're not doing what we've asked them to do. But here at this forum, we're learning more and more about how important it is to understand adverse childhood experiences and how, as health professionals, if we do understand this, it would help us to do better as far as working with our patients and as well as the home, helping the home to be a better place to be.
I was on the circuit court bench for 21 years. And out of those 21 years, I served 15 years voluntarily in the juvenile division. And that's where I came into contact with families that were in deep distress. But what would I like people to know about the justice system? It is not the solution to our problem. It's a place where children and families come because they've been abandoned, abused, neglected, or they're delinquent kids. But it's not the answer to the real issues that society and our community has. And the issue that the community has, how can you keep the community healthy? And it's a long-range plan that has to be in place. At times I would describe the justice system, at least in the juvenile, we're the garbage men. We pick up the things that have been abandoned, thrown away, abused, and now we're supposed to do something with them. And many times we did, but many times we couldn't. The children were too damaged. The families were too far gone. The fathers were in prison. Mom was on heroin. And what were the children to do? They had no place to go. So the judicial system is not the answer. I mean, we're there to provide judicial services, but I can tell you we're not a social services agency.
Our school district is very diverse and very large. A lot of people don't know it, but we're about 186,000 students. 62% of them require free and reduced lunch, which means it's a proxy for poverty. So we have a very large impoverished area. We're about a third African American, a third white, and a third Latino. So many of our students face issues that as adults we would struggle with, but as a child they don't have the ability either cognitively or emotionally to deal with very adult problems. Some of that can manifest in bad behavior at school, avoidance, suspension, skipping school, etc. So being trauma informed, I think, is critical. It's important that the general public understand that our kids are being impacted, whether it's by violence in their own family, drug addiction, issues that spill in from across the country, terrorist attacks, things that really children aren't capable of handling. I've got 2 children of my own that ask me really tough questions about the world that they live in. And even though my wife and I have a lot of experience in education, we sometimes struggle in that area. So it's important that families and community members understand that our kids need help. This is an area that the community really should be working together on trying to solve issues that are complicated.
I was initially a trauma ICU nurse at St. Mary's Hospital for about 10, 12 years. Then I had a child and my son was diagnosed with depression and dyslexia. So when he was 7 years old, he wrote a note to his kindergarten teacher, or second grade, I can't remember, that he wanted to kill himself. So ever since, I have been dealing with a child who has severe depression, and he's now almost 17. And we have gone through a lot of trials and tribulation, and one Baker Act, a couple of public schools, because the system wasn't quite prepared to deal with a child that was different. They didn't have the resources. So with that said, I needed to become more informed to be an advocate for my child. So I changed from trauma to psych, and then became a psych nurse practitioner, and then I researched trauma because as an immigrant to this country, I do believe that the lifespan of different adversities through your life impacts your health one way or the other, either physical, emotional, or spiritual, but at the end of the day, all the things that you accumulate through your life impacts who you are today.
I come from a background where I had 2 parents, my father and my mother was disabled for a majority of my life while I was a kid. She suffered from kidney failure, Once she had a brain tumor, 2 hip replacements, thyroid operation, and many other health ailments. But what I saw in my mother was, although she faced those difficulties, she was still a survivor and a fighter. Every day she moved forward. She never let her illnesses or her ailment affect the people around her. So she moved forward strong, fast, and hard. She had a lot of faith. And my father as well, he's a hard worker. I remember at the age of 55, after my mother had passed away, my father actually worked in the labor pool to make sure he was able to keep ends or make ends meet while I was in college in Tallahassee. So I've watched my family struggle and fight, but I know in order to move forward and have a sane mind, you have to exercise, you have to talk to people, you have to be able to use your coping skills and build relationships with people so that you're able to move forward. When it comes to mental health at the state level, we have to continue to be diligent in our fight to make sure that there's funding available and there's resources and policies put in place to make sure that we're protecting the least of us. The most of us have to protect the least of us to make sure that we have healthy individuals growing up and becoming great citizens in the community, not only in Palm Beach County, but in the state of Florida. And it's up to us as legislators to know and understand the things and the reasons that children have trauma or children go through trauma. So we have to know those things and we have to fund those things.
Instead of asking what's wrong with you, the idea is to say what happened to you, to get the child start to talk a little bit more. And I just thought all of these things compiled together, it's research that can actually change a child's life for the better. I was a reporter for many years in this county, and so I saw a lot of children who had behavior issues, a lot of children who were on welfare, who were not well taken care of. You know, the challenges that children face in our area, in Palm Beach County in particular, are extreme. I mean, I think people don't think about that because they think we're such a wealthy community, but there's children right here in our backyard that need help.
So I've been a psychologist for almost 25 years. I've been working here in Palm Beach County for about 23 years. And I think throughout my career I've seen tons of cases and family situations where they've experienced significant trauma, and then through accessing services and building their resiliency, they've gotten much better. Having a lot of ACEs does not mean that you are impoverished to some state of being. There are lots of opportunities. People are extremely resilient. The research shows that. Our brains are resilient, our bodies are resilient, so we just need to have hope.
When I went to the first seminar on ACEs and they did the laundry list of things that were ACEs, I found myself getting very emotional during it because I had 8 of them, and that's usually considered on the very high end of them. But I also realized that, particularly with my grandparents and a few special teachers, I had people that supported me through the whole thing and some of the things that were going on in my household. And so I was able to build resilience, and I think that's what we need to do for all of our kids.
Tammy's interview was so touching, for her to share that she had 8 ACEs, and I think it brings so much hope because we, in our work, we want to instill that hope in the families that we serve. And for somebody of her level of leadership in the community to say that she has 8 ACEs, and look where she is at now, but she was able to do that through those buffering relationships.
And that's that hope and that resiliency that we're looking for.
And that's why we do what we do.